The Ottawa ankle rules indicate when radiographs are needed for the ankle or foot. For the ankle, 1. Pain along the posterior distal 6 centimeters of the lateral malleolus, pain or tenderness at the medial malleolus, and or the inability to bear weight for 4 steps. Radiographs for the foot are indicated if there's pain or tenderness on the base of the 5th metatarsal, pain or tenderness at the navicular, and or the inability to bear weight for 4 steps. The test item cluster for a patient who would respond to spinal stabilization. 1. Age under 40 years old. 2. Average straight leg raise greater than 91 degrees. 3. Aberrant motion present, which includes a painful arc, instability during motion, reversal of lumbopelvic motion, or a pseudo-Gowers sign. 4. Positive prone instability test. Raise your legs. A positive sign for the prone instability test would be pain in the resting position and symptoms subsiding with the legs raised. The test item cluster for a patient who would respond to spinal manipulation. 1. Duration of symptoms less than 16 days. 2. No symptoms distal to the knee. 3. An FABQ score of less than 19. 4. Hip internal rotation greater than 35 degrees. And 5. A hypomobile segment. The McMurray test for meniscal lesion. To test the medial meniscus, the knee is fully flexed and laterally rotated and then extended. To test the lateral meniscus, the knee is fully flexed, medially rotated, and extended. The test is positive if the action causes a snap or click that is often accompanied by pain. The Lockman test for assessing the integrity of the ACL. The test is positive with excessive movement or the lack of a firm end feel. The slump test. Go ahead and slump for me. Tuck your chin to your chest. Now straighten your knee and raise your head. The test is positive if the symptoms subside or the knee extends farther when the head is raised. The test item cluster for a patient with hip osteoarthritis. 1. A self-report of a squat is aggravating. 2. Active hip flexion is painful. 3. Active hip extension is painful. 4. Passive hip internal rotation less than 25 degrees. 5. A positive Gowers test. The test is positive if the examiner observes any irregularity in the movement, pain, or the patient has apprehension to the test. The Thompson test for Achilles tendon rupture. The Faber test. For diagnosis of glute and hamstring weakness, the patient would present with isolated weakness of hip extension, hip external rotation, hip abduction, and knee flexion, along with normal sensation. For diagnosis of an L5-S1 radiculopathy, the patient would present with radiating pain in the lower extremities, sensation deficits of the L5-S1 dermatome patterns, myotomal weakness in plantar flexion, knee flexion, and great toe extension, diminished or absent Achilles tendon reflex, a positive straight leg raise, and a positive well leg raise. So positive straight leg would be symptoms on the raised leg. Positive well leg would be symptoms on the non-raised leg. along with a positive slump test.